Hello viewers, you are welcome to a new episode of our educational videos. In this video, I will be talking about concept of nursing practice. Nursing as a caring profession has evolved from traditional method of caring for the ill to a scientific profession. The result has been the movement from the mystical beliefs of primitive times to a high-tech, high-touch era. Nursing as a profession combines the art and science in order to effectively and efficiently cater for the needs of individual, family, and the community, using scientific knowledge in a human nature. Nursing combines critical thinking skills with caring behaviors. Nursing requires a delicate balance of promoting clients' independence and dependence. Nursing also focuses not on illness, but rather on the client's responses to illness. For nurses to effectively address the need and concerns of individual or family, an understanding of the concept of nursing practice is required. Concepts literally means ideas or notion. Concepts are building blocks of theories. They are abstract ideas or mental images that seek to explain a phenomenon. Nursing profession as a discipline of art and science of caring for individual, family, and community is viewed upon four key concepts vis-a-vis concept of person, environment, health, and nursing. These four concepts were first identified by Virginia Henderson in the year 1991 as nursing meta-paradigm. This concept constitutes the key component of nursing philosophy, practice, and define the means by which an individual, community, or family should be built and treated within the confines of nursing profession. The four concepts are interrelated, and each is viewed upon the foundation of the concept that precedes it. Now, the concept of person. In nursing practice, human beings are considered in terms of their physiological, psychological, social, spiritual, and cultural entities. They are often evaluated in terms of their individual place in the society, as well as their relationship to their family, community, and the society as a whole. The role they play in the family and the society can also determine their level of well-being. Consequently, human beings are built in terms of their individual needs and how nursing practice is applied to meet these needs. The purpose of nursing is to identify how a particular individual needs are either met or not, and to predict future needs, as well as to prioritize those needs in order of importance. The concept of environment emphasizes that internal and external factors act directly or indirectly on human beings and affect their behavior and development. These factors include psychological, spiritual, social, physical, and cultural forces, as well as the environment in which nursing care is provided. The idea behind this concept is that environment influences individual and collective health, and that individuals who experience or receive a positive, comfortable nursing environment are more likely to demonstrate healthy behaviors as compared to those who receive low level of care or who receive a care in an environment that is not supportive or conducive for healing. The idea behind this concept can also be fully understood looking at the contribution of the modern-day mother of nursing. Where's the idea behind the concept of environment in nursing practice? This can be fully understood recognizing the contribution of mother of modern-day nursing, Florence Nightingale. Walking through the pages of history, she recognized that the impetus for healing lies within the individual human being, and focus of care is to place an individual in an environment that is supportive to the healing process. The areas that requires the attention of the nurse in the care of the patient environment include cleanliness, ventilation, warming, light, noise control, varieties, nutrition, advice, as well as observation of the sick in relation to the environment of nursing care. The application of this theory in nursing practice is that the nurse will provide a clean environment to prevent infection and to allow the nature to act on the sick one. Going forward, looking at the concept of health. Health, generally as defined by WHO, is a complete state of physical, mental, and social well-being, not merely the absence of disease or infirmity. The concept of health refers to an individual's physical, mental, and social well-being, and at what point they are placed on the health and illness continuum, which ranges from good health to a poor health or even death. Health is considered to be affected by certain factors, which include genetic factor, environmental factor, lifestyle, as well as external mechanisms, such as microorganisms, changes in temperature, and chemicals. A person's place on the health and illness continuum is constantly changing, and in a nursing context, it is the responsibility of nursing professionals to identify the patient placed on the health and illness continuum and take appropriate steps to help that individual or community improve their level of well-being. Concept of nursing. Generally, nursing refers to a process of care for the health of human beings and assisting an individual in meeting their needs, while also identifying the need for teaching them the basics of caring for themselves. The responsibilities of the nursing professionals are to promote good health, to prevent disease when possible, to promote healing in those who are ill, and to ease or alleviate suffering of the dying patient. The concept of nursing goes beyond the healthcare facility to the community base as well as society as a whole, and usually views an individual health and the environment as closely related. Nursing is often defined as a care that is tailored to the need of individual and that is provided in an efficient and effective manner. The overall objective of nursing practice is to care for the individual, family, and community, and to determine their attitude, behaviors, and various responses to illness, thereby planning and implementing an individualized nursing care that prioritizes their needs. To do so, therefore, nurses are required to have an understanding of individual, family, and community in relation to their physical, physiological, psychological, social, spiritual, and cultural well-being. Hence, the need for the concept of nursing practice as identified by Virginia Henderson. Thank you for watching our educational videos. Please subscribe to our YouTube channel at Kevin Nurse's Documentary. Kindly drop a comment, like, and press on the notification button for more updates. See you next time.